Hi everyone and welcome to my presentation. My name is Ellen Van Druten and today we're going to be talking about child mortality in sub-Saharan Africa and how it relates to the Sustainable Development Goals, or the SDGs. The SDGs make up the most recent Sustainable Development Agenda from the United Nations. They replaced the Millennium Development Goals, which ended in 2015. They are broad, total 17 altogether, and range from ending poverty to protecting the planet and ensuring prosperity for all. The ultimate goal here is that the individual governments of these developing nations would take ownership of these goals in order to have the best outcomes. We're going to look at Goal 3 specifically as it relates to child mortality. Goal 3 is to ensure healthy lives and promote well-being for all ages. A specific target under this goal is that by 2030, we would end preventable deaths of newborns and children under 5 years of age, and by 2030, we would end the epidemics of various communicable diseases, including AIDS, malaria, hepatitis, and tuberculosis. Some statistics on the prevalence of child mortality in sub-Saharan Africa include that children in sub-Saharan Africa are 14 times more likely to die before the age of 5 than the rest of the world. About 4.8 million children in sub-Saharan Africa die annually before age 5, translating to about 9 deaths every minute. This accounts for 45% of the world's total child mortality. This is a chart that shows a breakdown of the child mortality in 2016, and we can see that 45% of all under 5 deaths occur in the neonatal period. With that, the sub-Saharan Africa region has the highest risk of death in the first month of life, or the neonatal period, as well as the highest newborn death rate in the world. Both communicable and non-communicable diseases affect developing nations disproportionately, including those in sub-Saharan Africa, especially vaccine-preventable and treatable conditions. We can see this disproportionate rate through the example of the infant mortality rate in Iceland is just 2 per 1,000 live births, while in Mozambique it's 120 deaths per 1,000 live births, and that's 60 times higher in Mozambique than in Iceland. Some of these particular reasons are neonatal sepsis, pneumonia, diarrhea, malaria, and malnutrition. Here's another visual breaking down the estimate of child deaths by cause in the region of sub-Saharan Africa in 2015, and we see here that pneumonia is a pretty big player. While sub-Saharan Africa has seen a decline in under 5 deaths mortality since 1990, they are still among regions needing substantial progress today. It's estimated that from 1990 to 2015, the under 5 mortality rate did decline by about 53%, and the death rate decreased from 91 deaths per 1,000 children to 43 deaths per 1,000 children, as noted in 2015. However, the goal was to decrease deaths by 2/3. So while these are both significant strides in the right direction, the Millennium Development Goals were not met in sub-Saharan Africa, requiring updates and put in place by the SDGs. So these inequities in health directly relate to social justice and the need for human rights to be in the forefront of approaching these solutions. So as we've seen thus far, child mortality disproportionately affects developing countries. This is rooted in disease, perpetuated by a lack of access to care, location, poverty, and education. Therefore, looking at these issues through a human rights lens, we may be able to concurrently address some pretty major global issues. So I've been able to create some ideas and concepts of social justice in regards to moving forward with these health goals, as well as backing them with verses from the Bible in order to integrate that Christian perspective, because as public health professionals and as a Christian, we have a responsibility to both. So you can see here that giving to those with less must be a responsibility of those with more. This is rooted in the concept of social responsibility, and we see that in Proverbs 14:31, whoever oppresses a poor man insults his maker, but he who is generous to the needy honors him. Another social justice concept is that inequity in resources and opportunity must be lessened for the good of others, both locally and across the globe. And we see that supported in the Word of God in Isaiah 1:17. And fundamental human rights must be implemented and upheld by those who possess the knowledge and resources to do so. And we see that backed by Psalm 82:3. So as Christians and as public health professionals, these should all be priorities to us. And related, we must pursue research and health advancements from an ethical perspective. Doing so is necessary because we know that the burden of disease is significantly greater in the developing world, but conducting the research ethically will require a strict ethical framework in order to ensure beneficence, respect for persons, and distributive justice. So looking at beneficence specifically, this is ensuring the benefit of research rooted in the converse concept of do no harm or non-maleficence. This, in summary, means that researchers must maintain the same standard of care for patients in the developing world as they would here in the US or Western Europe, for example. There must be a universal standard of care. Respect for persons is the ethical consideration of autonomy and informed consent. Informed consent is crucial when sharing information about the study so that the participant is freely agreeing to participate. This includes letting them know all the potential risks and benefits, as well as the goals of the study, time requirements, procedures, and how to withdraw if needed. These are both crucial because individuals may feel pressured in the developing world to participate because this may be their only opportunity for any source of health care. And third, distributive justice aims to ensure that populations who bear the risk of the research will also reap the benefits. For example, if a new vaccine, Ebola for example, was created in Ghana, the participants of that study should have access to that vaccine when it's placed on the market. And moving forward to those potentially conducting the studies or particularly interested in studies in sub-Saharan Africa, the developing world as a whole, are these major stakeholders. A few examples of major stakeholders include UN agencies like World Health Organization or UNICEF. They have established the global health initiatives and the improvements are at stake. Local governments made up of the Ministry of Health, political parties, lawmakers, financial institutions, and education systems are all wrapped up in the improvement of health and will all be able to reap the benefits or be affected negatively from no progress. Global nonprofit health-based organizations are also invested in these improvements, both in the result as well as the process. And the citizens and individual patients, of course, are interested and invested in making sure that the best is at the forefront. So we can take a quick look at a successful health service model that was implemented, keeping all of this in mind in order to serve as an example to countries in sub-Saharan Africa. Iran was able to successfully achieve Millennium Development Goal 4, which was decreasing under 5 mortality by 2/3 by 2015. They did this by implementing a primary care provider program in rural areas, as well as establishing more advanced healthcare facilities for mothers and newborns in the most vulnerable communities. So again, this could serve as a great example and maybe be replicated for infrastructural and resource improvements, leading to achievement of those SDGs and especially Goal 3. So moving forward, based on what we know about the problem and what the example we've seen as a potential solution, what do we need to do specifically in sub-Saharan Africa to reach Sustainable Development Goal 3? We definitely need to increase awareness of inequalities by educating those in the developed world as well as developing world as to the need, and continue to fund and grow global health initiatives like the Sustainable Development Goals as well as others in the global health realm. We also need to increase education for women. Studies have shown that access to education for women is substantially related to child survival, as well as the health and survival of themselves and children. We also need an increased accessibility to healthcare resources. Investing in global health can be costly, but UNICEF has a study that's shown that investing in the health and survival of the world's most deprived children saves more lives per dollar spent. And if $1 million was spent to expand immunization coverage in the developing world, preventable disease would be avoided and 1 million children's lives could be saved each year. This is a cost that's greatly outweighed by the benefits. So I just want to thank you for listening. This is a conglomeration of both the problem, what's being done, and the potential solutions. The Sustainable Development Goals are working toward some big things, and hopefully we've identified some strategies that can lead to a successful achievement of these goals and decrease child mortality in sub-Saharan Africa. Here is where I got my information, a few pages of references. And again, thanks for listening and hope you have a great day.